Assalamu alaikum warahmatullahi wabarakatuh. Jazakumullahu khairan. Welcome back. And as I inshallah mentioned in the last program, this is a very, very important program. We have here Dr. Marwan, who is a medical doctor at the Ohio State University. He's attendant and also founder of Ask a Muslim and Islamic senior Islamic scholar. So my dear respected brothers and sisters in Islam, today inshallah ta'ala, let's listen from the expert, from the scholar. And today inshallah the topic we are going to touch is mental aspects of drug abuse or drug addiction, substance abuse. Inshallah ta'ala. Welcome back. Jazakallah khair. How did it affect the brain? Let's say this. And I have another question too, inshallah ta'ala, and how to overcome addiction and also a suicide.
Beautiful.
Those are two. And I will ask you inshallah ta'ala about the Islamic aspects or perspective. And jazakallah khairan. What are those two questions?
So let me kind of start with, so as far as alhamdulillah rabbil alamin, and after it's very important for the people who are watching this program is to kind of realize that when someone become a drug addict, yes, is one of the prominent organs or that is going to affect your brain, okay? But it's also going to affect other part of your body too. Like for instance, it would affect, I mean, you will see the individual have no appetite, they have headache, they have anxiety, they have high blood pressure. Sometimes they come in with heart attacks to the hospital. Sometimes they become, it's problem for them to go to the bathroom. There is change of temperature, and this is and really this varies from one drug to another. I mean, the thing is, if we're gonna to kind of classify what's the effect of each different drugs and how does a person present once they're dependent, it's a whole talk by itself. But here we're just talking about the overall things that is common among all people who are illicit drug users, and beyond the fact that the injuries that they would suffer, like whether for instance from needle injection, and there is one of the most important things that people come to the hospital, and this is something that is very drastic, my respected brothers and sisters, is people come in and where they have infected themselves to the point that the blood is have bacteria, and they would have infection of their heart. This is disastrous. And the thing is, like I said, here, the mental issues is there, but on top of all of that, you have to stay in a hospital for 6 weeks minimum, getting IV antibiotics, and this is I mean, this is beyond when someone gets bone infection. This is beyond when sometimes people could lose their sight or something, and sometimes people could have a sudden cardiac death. So it's important. So there is a lot of things that come along with it, and part of that is psych related or things that is associated with substance abuse. And namely, there are a lot of times people are more anxious, they have anxiety disorders. A lot of times people have depression, and sometimes these people are more prone to suicide. And why is that? This is a very important question. And this is especially when we talk about the youth. So what happened is our brain, my dear respected brothers and sisters, develop in that age. Like without being exposed to drugs, this is when our brain is developing, the period of our adolescence. So imagine as your brain is being developed, you are being introduced to these drugs that mess up the hormonal system, the way your nerve is working, and so a lot of times people have these problems, these psychiatric disorders because of that. And a lot of times these mental aspects would stay with them for the rest of their life. Why? Because as the brain is developing in this area, it have external factors that is interrupting it. And this is extremely important. So this is definitely, my dear respected brothers, it's not a joke. Because this is nothing like a lot of times. Oh well, I'm going to overcome it. One time I'll be okay and I'll stop everything. No, a lot of times this is not as simple as that. So all drugs, like for instance, we're talking about like especially nicotine and cocaine, and marijuana, they affect the brain and they affect a circuit called the reward circuit, which is part of the limbic system, or part of a system, a nervous system within our brain. So what does drugs do? They hijack this reward system, causing it to usually have large amount of dopamine to flood into our system. And dopamine is like the reward hormone that is being excreted. So when you have a lot of this dopamine within your brain, it causes this, the feeling of being high, or what we call it euphoria, and this is what associated with drug abuse. Every time someone uses drugs, what happens? They're looking for this buzz, this high, and what happened is a lot of dopamine is being excreted, and they wanted to feel this more often, and that's what really messes up in this. That's
good. Okay, people who are watching us, as I mentioned, we have this is very, very important program, especially parents and those who are responsible and guardians. Jazakumullahu khairan. We have to just very careful about how our kids are behaving, who are they hanging out with, where they go into, how their behavior is changed, and also the way they dress. Sometimes, you can see like someone else is just investing into them. So inshallah, let's come into the Islamic perspective. And there are something called in Islam, when Allah subhanahu wa ta'ala sends down the Sharia, there's a maqasid of Sharia. That Allah subhanahu wa ta'ala have, ordered us to maintain the well-being of the life, your health, your, nasl, all kind of stuff. So what is the Islamic perspective on keeping your mental health in a good, if you have another better way to, inshallah ta'ala, jazakallah khair.
So the thing is, subhanAllah, part of the way we believe as Muslims is the fact that we just like it's Islam in itself, my dear respect brothers, it's not just came to show us how to pray. It encouraged us to make sure that we have a healthy body, a healthy brain, and to become functional in the society. Allah subhanahu wa ta'ala, when He mentioned in the beginning of Surah Taha, Allah subhanahu wa ta'ala said, Taha, ma anzalna alayka al-Qur'ana litashqa. Allah subhanahu wa ta'ala, He have not revealed this Qur'an to us so we have a disastrous life. وَمَنْ أَعْرَضَ عَنْ ذِكْرِي فَإِنَّ لَهُ مَعِيشَةً ضَنْكًا. And whoever tried to leave the dhikr of Allah subhanahu wa ta'ala, he have a disastrous life. And I come, my dear respect brothers and sisters, I come from the school that I believe that person who is true abiding to Islam, they should not have any psychiatric problems. Yes, there is sometimes, people are genetically have abnormal levels of dopamine, and that's why they tend to have like all these psychiatric problems, depression, etc., anxiety. Yes, there is possibly more certain people more prone than others, but in the same token, our deen is one of the most important aspects of it. It encourages us to have a healthy way of thinking, a healthy body, and that's why one of the most, as you mentioned, Sheikh, is the fact that one of the most important maqasid of Sharia, the Islamic ruling or the Islamic law is what? Is al-aql. That we have to make sure that we have sanity, and preservation, the preservation of the soul, and this is and preservation of the body. So this is very important that we, that's why Allah subhanahu wa ta'ala have forbade for us to be introduced to any sort of intoxicants, because once someone is intoxicated, they have no free will. They have no control over their body. They cannot make their own decisions, and this is extremely important. And other people from the outside easily manipulate them. And Prophet Muhammad sallallahu alaihi wasallam, when he forbade us, and he have cursed those who are carriers, the sellers, the buyers, the handlers of alcohol. Why? Because all these people, all these people are contributing to the same problem, in which that, they are helping destroying a family. They're helping destroying an individual. They're helping destroying possibly a society. And my dear respect, brothers, this is very important. And maybe many people, and even the average American, they need to realize this. If alcohol was abandoned, if outlawed in America, they say that 40% of all admissions in America is going to go. We have problem now with how full is our hospitals. Imagine if and this was not new. I mean, by the way, in the 1900s, early 1900s in America, they enacted a law that they forbade selling alcohol, and this is something we have to have. Yeah, so this is very important. Why? Because they know the disastrous effect in the brain. So, and Islam, my dear respect brothers, does not it goes along the fitrah of the human being. It does not really invent something in you. There is a relationship between the heart and the body and the soul and the brain. And Islam, my dear respect brothers and sisters, he have arranged this and tell you, you know what? Just like the fact that you have to take care of your body, to cleanse it, to make sure that you eat well and behave well, there is certain things that you have to do in order for us to have a healthy brain.
MashaAllah, Jazakallah khair. My last question, Dr. Marwan, is that what are the role of the Masjid to promote this, the healthy perspective or functionality of the mental for our youth especially? And also, as well as the Islamic organizations, as well as Ask a Muslim, what are you guys doing to help the young folks to change their perspective, to change the way they are thinking about it?
So it's important, my dear respected brothers and sisters, that as Muslims that we are part of the society, and we have to make sure that we are active members that helps the community to make sure that we are overcoming this pandemic. And like I said, we are part of this society. We should be active in trying to promote what is good for our adolescents, what is good to make sure that the families are united, and what is good for us to establish a peaceful, healthy family that are existing in each and every corner of this society. It's extremely important, as you know, to kind of start with this. It's important for imams, and it's important for parents, and it's important for religious leaders, for them to know how to recognize these things, you know. And especially here we're talking about, because here when someone is being, when they're a drug addict or they're abuser, there are certain risk factors, or there are certain characteristics that these people tend to have themselves. They end up doing. Like for instance, you will see, for instance, the person is being, they have poor performance in their work. They're being rejected by the family. Sometimes these people who are being bullied, you know, they have financial problems. They have no social support. They feel shame and they feel humiliated. So that when someone, like as a leader, when someone sees someone that have these set of the characteristics, it is important for him to recognize this thing. And as I say, there's a mnemonic, and I'm gonna say, it's like what is considered to be the signs. You know, this is signs that someone is in danger. So there's a mnemonic. They call it is path worm. So I'm gonna ISPATHWARM. So this is like kind of the mnemonic, and I want people to kind of just bear with me to see what kind of things that we need to recognize. We have to, because as you know, before we treat and intervene, we have to make sure that we know like what is the signs and symptoms as leaders and as people who are prominent within the community. We have to make sure that how to recognize this problem. So number one is that you see people being despair. They have some sort of like ideation, maybe like they have suicide ideation. They're thinking, what is the point of life? Why should be I here? And etc. You see them involved in substance abuse. You know, they're missing work. They're having marks within their arm. You know, they feel purposeless, meaning that they feel like, oh, why I'm here? There is no point. Why religion, etc. You see them for anxiety. They're anxious. They're mutawattirin. You know, you see them agitated. They're having nightmares. They're trapped. They're feeling that there is no They can't get themselves out of trouble. They feel hopelessnesses. They have no hope. They feel withdrawal from the community. They're isolated. And that's the people, this is what the most important thing. When someone not coming to the masjid, when someone is not attending your church, when someone is not, you're having a family and a dinner, or somebody is absent, this is issue. This is the most important signs that you have to recognize. When someone is being too much angry, when they're being cornered, they're feeling because they have no controlled anger. It's important. Someone is reckless, meaning that they do things without thinking of consequences, and also mood changes. This is the last letter, mood. Sometimes they're sad, happy, angry, is sad. It's all over. They're all over the place. When someone sees these things, now it's time for me to intervene. It's fun for me to recognize the problem. It's important for me to recognize this. And why we do this? Because thing is, as Muslims, we should be able to. Part of being as a Muslim, we look after the youth. We want to make sure that the youth is healthy. We want to make sure the youth is being educated, not necessarily about the religion, but also how to deal with the outside world and make sure that once they're exposed, they're immune against all of these toxins. Because if they're not well educated, they're more prone to falling into this. And the last thing is, when someone the quick thing when someone is having a problem, they say you have the way you work with it is by ACE. Okay, you ask, A, you care, C, and you escort. What does it mean? So you ask, you tell them, what's going on with you. Show yourself. Ask him question. What's going on? What happened? Why you're like this? What's going on? So you ask, and a lot of people, these people, they feel withdrawn from the community because no one is caring about them. So when you ask, you show them that you are caring. You show them that you want to be part of their problem. You show them that you're willing to help them. And caring is very important because these people have no one to listen to. They want to discuss this issue with some individual, but no one is stepping forward for them to be part of their life. And what happened is that you listen, you discuss, you check on them, but it's important that you don't judge them. But you could encourage them to, but you don't judge them. Tell them, how dare you do this? No. The point of you asking and be caring is for you not to judge. Because they cannot handle you judging them and you punishing them. No. These people are very fragile. This is the part where you take care of them. Tell them, hey, I'm going to help you. We're going to go through this. You encourage them. And last thing is you escort them. How? Whether through psychological rehab, whether it's through calling 911, whether it was seeing their psychiatrist, or possibly an imam or someone who is an expert in this field to be able to take care of them bidnillah ta'ala.
Jazakallah khair. That inshallah ta'ala concludes our program today, and hopefully inshallah the doctor, we will have him in some other inshallah ta'ala future time. We were very fortunate, and it's a very good opportunity to have him to talk about the mental health and drug abuse, especially someone who is expert, someone who works at the hospital day in, day out, someone who is also an Islamic scholar. MashaAllah, may Allah subhanahu wa ta'ala reward him his time. We will have him inshallah ta'ala in future many times. Jazakallah khairan. And also the brothers and sisters who are watching us inshallah ta'ala, until we meet next time. Assalamu alaikum wa rahmatullahi wa barakatuh.